I'm Dr. Joe Esposito, and welcome to our podcast, For the Health of It. Remember to subscribe to our podcasts, and I'll help you naturally get well and stay well.
The information presented on this program is not intended to take the place of your personal physician's advice, and it is not intended to diagnose, treat, cure, or prevent any disease. Discuss this information with your own physician or healthcare provider to determine what is right for you.
Are you suffering needlessly? Dr. Joe can give you advice on how to naturally get well and stay well. Dr. Joe Esposito.
What we're talking about today are some topics in the news, headlines, and kind of going beyond the headlines. What's really going on when you read these stories and find out why you need to know more information. A little investigative reporting today to try to get you the information that you need so you can naturally get well and stay well. And I say all the time, you need three things to get well and stay well. A normally functioning nervous system, which we as chiropractors work on every day. Normally functioning digestive system. So if you have acid reflux, heartburn, burping, gas, bloating, your stomach may be pushing up against your diaphragm. If the stomach pushes up against the diaphragm, you can't digest your food very well. And so the food isn't being digested, so the nutrients aren't being absorbed, and you may not be getting all the health benefits that you need, even if you have a good diet. If you don't have a good diet, multiple times worse. So you have to have a normally functioning nervous system, a normally functioning digestive system, and good nutrition. That's the goal. And when it comes to nutrition, it's very simple. It's not some mystery. Gosh, there's so many books written on nutrition and DVDs and videos, and all that's great, but it's simple. The best diet for a human is going to be fruits, vegetables, nuts, and seeds. A good portion of it raw, 50, 60% raw. So that's salad, broccoli, cucumbers, tomatoes, avocados. And you want to make sure that you're drinking lots of water, getting lots of rest. If you have neck pain, back pain, shoulder pain, these are telling you that there's something wrong with your nervous system. If you don't have pain, you may still have pinched nerves because 90% of your nerves don't feel pain. And so again, getting to the cause of the problem, not just treating the symptoms. And one of the things I see a lot in my practice, been doing this for 33 years, is when I ask people, you take any medication? Of course, blood pressure is number one, diabetes and cholesterol are number two, probably tied for number two. And then when I say surgeries, the number one surgery that I see among women is a hysterectomy. And for years we thought that, well, you know what, it's no big deal. I remember I was dating a girl one time. I was 29 and she was 40, so yeah, she was a cougar. And she went for her checkup and the doctor said, "You're going to have babies?" And she said, "No, I don't plan on having any babies." He goes, "Well, let's just remove your uterus then. You won't need it." And we kept back and we talked about it. And she said, it didn't hit me right that the doctor just wanted to remove my uterus as a form of birth control. And I thought, yeah, your uterus is really important because it produces hormones. And even as you go through menopause, it's better to have all the parts, if you can. If you need surgery, I support it 100%. But this was an interesting study. Women who undergo a hysterectomy are greater risk for heart disease and other health issues, even if they keep their ovaries. This is new research that just came out. Hysterectomy is the second most common gynecological surgery, and most are done for benign reasons because most physicians believe that this surgery has minimal long-term risks. And this is from the lead researcher, Dr. Shannon Tommaso of the Mayo Clinic in Rochester, Minnesota. So it's just done because doctors think it's a pretty safe, easy surgery. The results of this study, we encourage people to consider non-surgical alternative therapies for fibroids, endometriosis, and prolapse, which are the leading causes of hysterectomy. Now, how many of you have fibroid tumors? Raise your hands. Yeah, a lot of you. I see it all the time. Take x-rays. Oh my gosh, there's a fibroid. We see it in the breast. We see it in the uterus. And I said, what did anyone ever tell you about it? Well, it's there and they're just going to monitor it. And if it gets bigger, they're going to remove it. All right. Again, please understand, I'm not picking on my colleagues. I'm just giving you an alternative thought process here. And if it's like saying, well, my car is starting to make noise. Well, let's just wait till the engine falls out and then we'll do something about it. It's kind of like scoliosis. As a chiropractor, I see a lot of scoliosis patients. And I say, what was recommended? Well, they're going to monitor it. And if it gets beyond, 30-degree Cobb angle, a 32-degree Cobb angle, whatever it is, that's the way they measure the spine. Then they'll put a rod in my spine or they'll do surgery. It's just going to monitor it and see if it gets worse. Well, what if we just got in there and found out why you had scoliosis? I don't know. No one ever thought about it like that before. What I find is every scoliosis patient I've ever seen, and I've seen a lot of them in my career, there's a muscle called the psoas, P-S-O-A-S. And the psoas muscle spasms. And when we release the psoas, it's a real simple technique to kind of push on the abdomen to get it to release the psoas. Then we do a series of chiropractic adjustments, and in most cases, major majority, you start to see the spine start to straighten out. Well, that's pretty cool, isn't it? Now, is it sometimes, depending how bad it is it ever perfectly straight? Sometimes not, but it's either going to get better or it's going to get worse when you have a spinal problem. And the older you get, if it lasts, I always say if it lasts more than 3 or 4 days, you definitely want to get your spine checked, because chances are it's just going to get worse and worse and harder to fix. But I digress. Let's go back to hysterectomy, this study. Study tracked 2,100 women who underwent a hysterectomy and a matched set of controls who hadn't undergone a procedure. Hysterectomies were performed between 1980 and 2002. In all the cases, the ovaries were not removed. Because it's a retrospective study, the study could only point to associations. They couldn't prove a cause and effect. In retrospective, mean we look back and said, oh, this is what happened. But Mayo Clinic, they report, compared to women who haven't had a hysterectomy, women who had the procedure experienced an average of 14% higher risk of abnormal body fat levels, 13% higher for high blood pressure, 18% higher for obesity, and 33% higher risk for heart disease. That's substantial. Even though it's a retrospective study, and it's not necessarily cause and effect, it's pretty substantial, those findings. Long-term health issues with hysterectomies were especially pronounced for younger women. The study found that women younger than 35 had a 4.6 higher risk of congestive heart failure and a 2.5-fold higher risk of coronary heart disease. That's buildup of plaque in the arteries. Now, I see that a lot. My doctors and I, if we take x-rays on the patients, many times we'll see buildup of the artery plaque when we take a low back x-ray. Because there's a big blood vessel called the aorta, and it splits off right around your third lumbar, if you know where the anatomy is, and it becomes what's called the common iliac arteries. And many times we'll take an x-ray of a patient and we'll see the plaque building up in the artery. And if we can see it in the pelvis, chances are it's also in your heart and your brain. And 100% of the cases, as far as I know, and I've researched this for 30 some odd years, 100% of the cases, the buildup is due to a bad diet. Never in my career has somebody come into my offices and said, you know what, Dr. Joe, I eat this great plant-based diet, 50, 60% raw, I take supplements. I've never seen somebody come in with hardening of the arteries. 100% of the time, it's the barbecues and the steaks and the meats and the burgers and the cheeses and the animal products and the sugars and the alcohols, 100% of the time. So the interesting part is that you have control over this. And a lot of cases come to us, and here this Mayo Clinic study is saying patients with fibroids, endometriosis, and prolapse should be looking for alternative health care first. And a lot of times we get patients on a good diet, we give them chiropractic care because you may have a pinched nerve in your low back, and that's the nerve to your uterus and your colon and your bladder. So we adjust that area, we get them on a good diet, we get them on supplements, and miraculously, I say that tongue-in-cheek, the patient starts to get better, they go back, they have some tests done, we take new x-rays, the fibroids are shrinking or at least stable. And the doctors always say, whatever you're doing, keep doing it. And a lot of my doctors around are my friends, and they'll say, whatever Joe says, just do it. He knows more about this than anybody. Just do what Dr. Joe says. And they do, and they change their lifestyle, and they had hopefully a couple of good years to their lives. I also recommend when you do this, you start taking supplements, and the minimum supplement you should be taking every day is Dr. Joe's Super Greens and Dr. Joe's Essential Source. If you don't know what they are, go to my website, drjoeesposito.com. They're 2 powders, and I created these years ago actually for myself. And I started taking them, my staff wanted them, they started taking them, and then patients wanted to know what the staff was taking, and now we actually manufacture them. But if you take Essential Source, it's about 10 servings of raw fruits and vegetables in a powder form. Then we add prebiotics, probiotics, digestive enzymes, a complete multivitamin. The Super Greens gives you antioxidants. They alkalize your system, omega-3 fatty acids. So it's the minimum amount of nutrients your body needs to function in a day. And patients say all the time, if I don't take it, I see the difference immediately. And then they also say, Doc, I eat so much less now because I feel so much better and I'm getting the nutrients that my body requires that they're saving money. They're actually saving more money than they're spending buying the supplements. Now, it may take a few weeks for that to kick in, but patients are just thrilled. So we have patients come in as an alternative treatment to these problems that this study is talking about, hysterectomies, is out of Mayo Clinic, looking for alternative treatments to hysterectomy before they remove the uterus. we put them on a good diet, and this is for everybody, not just hysterectomy patients. Super Greens, essential source, plant-based diet if we can, more plants than animals, get chiropractic care. In most cases, the patients are thrilled. And I get this every day. Patients come in and they say, Dr. Joe, I don't know why I waited so long. I've had this problem for years. And I've been listening to you and reading your books and following your workshops online, and this is even before online existed. They come to my live lectures for 10 years, 20 years, 30 years. And every day, somebody comes in, at least one, usually many, and say, why didn't I do this sooner? Why did I wait? So what I want you to do is get off your fanny, go to my website, drjoeesposito.com, listen to my archived radio shows, watch my videos. So we have video blog and audio blog. Read the articles. If you have questions, send them to me through the website. I'm more than happy to answer your questions for you. And at least take Dr. Joe's Super Greens and Dr. Joe's Essential Source. And when you're ready to come see us, we'd love to have the opportunity for you to come into our offices personally so my doctors and I can do an evaluation on you. So let's go back to this hysterectomy study. This is the best data that shows women undergoing hysterectomy have a risk of long-term diseases even when the ovaries are conserved, meaning not removed. When women are increasingly aware that removing their ovaries poses health problems, the study suggests hysterectomy alone has risks, especially for women undergoing surgery, hysterectomy before the age of 35. A gynecologist who reviewed the findings stressed that for many women, there are alternatives. Some of the most common reasons women have hysterectomy is bleeding and fibroids. What I find, and I'll tell you what they recommend, but I'll tell you what we find, is pinched nerves in the low back. If you have a pinched nerve in the low back, those nerves control everything from the waist down. Back pain, leg pain, hip pain, knee pain, ankle pain, numbness, tingling, muscle weakness. But those low back nerves also control your colon, sex organs, and bladder. So now you might see gas, bloating, diarrhea, constipation, urinary, sexual problems. With men, erectile issues. Everything from the waist down is coming from the low back nerves. And it either is the direct cause or a complicating cause, and you want to get that fixed. Now, what they recommend, the medical world, is this study anyway, with many more treatment options such as endometrial ablation, where they kind of go in and they kind of burn the tissue, and uterine fibroid embolization, hysterectomy is becoming less of a last resort for premenopausal women. Dr. Adi Davido directs gynecology, Staten Island University in New York. He stressed the Mayo Clinic study was only using retrospective data, so it couldn't prove the factors other than hysterectomy were causing the women's health issues. Okay, so, all right, that kind of says what the study said. I would urge patients to take these conclusions with a grain of salt. It's important to note that a recent study is not a randomized experimental trial, and I agree 100% with that. It's always good to do a double-blind study, make sure it's independent. Got to be careful when you read studies sometimes, because as you read through the study, who funded it? Well, we found out that, I don't know, a certain milk is good for you. Funded by the milk industry. And so when you start to see the independent studies, that's when you really want to start taking note. Women that require hysterectomies are inherently sicker and are at increased risk of many diseases, says this Dr. Davidov maybe. And I agree. Absolutely. People come to me and they have a bad diet and we can say, oh my gosh, we found hardening of the arteries. So that means people that go to chiropractors have more hardening of the arteries than people without. No, people that are sick and tired of being sick and tired and come see me probably have a higher risk of having hardening of the arteries. But a lot of people are sick and tired of being sick and tired and do nothing. That's when the problem comes in. So you want to consider getting the body well. Check the nerves in the low back. Cut out your caffeine. If you have fibroid tumors, you cannot drink or eat caffeine. Can't do it. Get the diet straightened out. Get on a raw food diet, or mostly raw, 50-60% raw. Take things like Dr. Joe's Super Greens and Dr. Joe's Essential Source. Get the nerves in the low back checked. Make sure the bowels are moving 2 to 3 times a day. And if that doesn't work, again, we're assuming at this point that it's not life-threatening, the condition you have. If that doesn't work, you can always have the surgery. I tell my patients all the time, do what I say. And if I'm wrong, so what? I'm wrong. But if I'm right, which I am, then perhaps you want to consider this as your new lifestyle. And most people say, yes, exactly right. But as long as it's not a life-threatening situation, I want you to consider an alternative, conservative approach first. A more aggressive approach, maybe going to drugs second, and then surgery as a last resort. I don't see anything wrong with that protocol. I'm not saying don't do the drugs. I'm not saying don't do the surgery. I'm saying let's see if there's other ways we can treat these things before we get into the aggressive part. Once the uterus is removed, it's gone. We can't put it back. And there are certain times of complications as well, but just like anything, there's risk in everything. But if we can get the body healthy, this is going to sound silly, if we get the body healthy, chances are it won't be sick. So folks, if you want to come make an appointment to come see us, we have offices in Marietta, Duluth, and Stockbridge. We're chiropractors. And we work very closely with medical doctors and orthopedists and neurologists and holistic practitioners, holistic medical doctors, functional medicine doctors. We want to put together a treatment plan that's best for you, your friends, and your family. So if you're ready to make an appointment, go to my website, drjoeesposito.com, or just Google Dr. Joe, number one Dr. Joe in the world, and we will set you up a time to come see us. We accept people with all insurances, no insurances, car accidents, sports injuries. I have never seen a car damaged where the occupants weren't, ever. So if you were in an accident and a car was damaged, your neck is not as strong as the bumper on your car, and it had to be damaged. So if you're ready to get well, the website again to make an appointment, drjoeesposito.com, or just Google Dr. Joe, number one Dr. Joe in the world, and we will set you up a time for you, your friends, and your family as soon as possible. Because we want to, what's our phrase? Naturally get you well and keep you well. So go to the website right now, drjoeesposito.com. So I'll continue a little bit more on that, the uterine fibroid thing and the hysterectomy thing. Every patient I've ever seen, it has a disease. When we can do a test on their urine and test what's called their pH, their levels of acid in their body. And the sicker somebody is, the more acidic their body is. And if we can get people to alkalize their body, and we do that by eating a good diet. So then the question comes in, is it the good diet that helped or alkalizing the body that helped? I don't care. What I care is I want to get you well. Because we can alkalize your system. We can give you something like baking soda. But folks, don't ever do that. Excuse me, got excited. Don't ever take baking soda to alkalize your system because you can throw your body off very, very badly. But if we can get the body more alkaline and certain foods like fruits and vegetables, nuts and seeds alkalizing to the system, where could you get a supplement that will be loaded with fruits and vegetables, prebiotics, probiotics, digestive enzymes, a complete multivitamin? Where could you get something relatively inexpensive, about $1 a day, to get your body back to normal? That's why I created Dr. Joe's Super Greens and Dr. Joe's Essential Source. They're each about $1 a day, so it's maybe $2 a day if you take both. And I think you should take both. But when you take that, you're giving your body concentrated, super concentrated form of vitamins, minerals, and nutrients that are easily absorbed, that come from a whole food source. They're not synthetic. And that's a whole nother show I can give you on synthetic vitamins and how dangerous they are. So, and every study I ever saw that said that a supplement didn't work, 100% of them, they use synthetic supplements. They never use a whole food supplement. When I see studies that say it does work, many times they're using a whole food supplement. So when I say whole food, it means it's not synthetic, it's not man-made. It comes from a plant source. So Dr. Joe's Super Greens and Dr. Joe's Essential Source, I feel, should be the standard that everyone start their day with at least once a day. Now, if I have a date, if I'm going hiking, if I have a bunch of lectures in one day, or if I'm going to do a bunch of radio appearances, I'll take them twice a day. But you can get those on my website, drjoeesposito.com, or just Google Dr. Joe. Also available on Amazon. If you have an Amazon account, you can get them there too. We also have other supplements. We have Seasonal Tonic, which I take when I have a cold or flu feeling coming on, because it's ginger, horseradish, cayenne pepper, onion, and garlic in an apple cider vinegar base. Tastes like it sounds. But it's great because it seems to knock out the viruses and germs, because it's antibiotic, antiviral, and antifungal based on the garlic. We have something called Wellness Booster. And the Wellness Booster has echinacea, pau d'arco, olive leaf extract, and studies have shown that can stimulate your white blood cells and help your immune system. We have Dr. Joe's Intestinal Cleanser. If your bowels aren't moving 2 to 3 times a day, I said a day, you should probably be taking Dr. Joe's Intestinal Cleanser as you change your diet. Once you get on a good diet, you won't need, in most cases, Dr. Joe's Intestinal Cleanser anymore. The other stuff you'll need. This one, I want to get you on it to get you off it. And again, relatively inexpensive for what you're getting. The Super Greens, the Essential Source, are around $2 a day. That's pretty crazy to get about 10 servings of raw fruits and vegetables. That's why I take it every day. I think you should too. And patients just report just nothing but good stories from it. And even for children, you could throw a frozen banana and some berries and some coconut milk or almond milk, make a smoothie. Amazing when you give your kids that much concentrated nutrients. So we're talking today about studies that are in the news and kind of digging behind the headlines. This was an interesting. Alcohol can cause irreversible genetic damage to the stem cells, study says. Just a pint of lager or a large glass of wine a day significantly increases the risk of mouth, throat, esophageal, breast, and bowel cancer. Why would you possibly want to do something that could significantly increase your risk of esophageal, throat, breast, bowel, and mouth cancer? Well, it helps me relax. You know what? So does chamomile tea. So does drinking a lot of water during the day. So does eating a plant-based diet during the day. So does kava kava, which is another supplement you can take, or St. John's wort. Those all work great. So you do this because the alcohol, of course, and the drugs, the alcohol we're talking about here, stimulate the pleasure centers in your brain. You don't get that when you drink chamomile tea. Alcohol can cause irreversible genetic damage to the body's reserve of stem cells, according to a study that helps explain the link between drinking and cancer. Now, what a stem cell is, if you don't know what this is, it's an immature cell, and it can become anything it needs to be. So a stem cell, if you put it in your thyroid, can become thyroid. If you put it in your joint, it can become cartilage. If you put it in your liver, it can become liver. So it's really cool, this stem cell. Stem cell research fascinates me. This paper provides very strong evidence that alcohol metabolite causes DNA damage, including to the all-important stem cells that go into making tissues. Alcohol, called acetaldehyde, it's a toxin that can damage DNA within the cells. It's a breakdown of that. However, these earlier studies have relied extremely high concentrations of acetaldehyde and used cells in a petri dish. The latest work showed that this chemical slices through the DNA, causing permanent damage if the effects of the toxins are not neutralized by two natural defense mechanisms. The first tier defense clears away the acetaldehyde, and the second one repairs the DNA. So your body has the ability to heal itself. Isn't that amazing? Something we've been talking about for years. How do you get your body's healing abilities up? Normally functioning nervous system, normally functioning digestive system, good nutrition. By genetically knocking out these two layers of the defense, scientists were able to show DNA damage accumulating until cells eventually stop working altogether. Study revealed DNA damage was exacerbated in mice when they lacked the first tier of defense, dehydrogenase number 2, aldehyde dehydrogenase 2, which prevents the potential toxic buildup of acetaldehyde. So your body has this ability to do its job. But if you keep damaging your body with things like alcohol, meat, sugar, dairy, coffee, soda, artificial sweetener, breads, cookies, cakes, donuts, pastas, pinched nerves, electromagnetic frequencies, not drinking enough water, not enough exercise, not enough mental stimulation, your body's ability to protect itself drops, and that's where the problems come in. So why don't you do this? Throw it out there. Let's see what happens. Throw it up in the air. What if you actually ate a good diet for 60 days? If you ate fruits, vegetables, nuts, and seeds? If you have neck pain or back pain or shoulder pain, of course, you should go to your chiropractor and get that checked. But I think everybody should get their spine checked. But in reality, most people, if they don't have symptoms, are not going to get their spine checked. You should, but most don't. But if you want to, we're more than happy to help you. And then if you have acid reflux or heartburn or burping, gas, bloating, you might want to consider going to my website, drjoeesposito.com. Look under blog, and you'll see Dr. Joe's articles. Read the article. It's about the 6th one down on acid reflux and GERD, gastroesophageal reflux disease. And it talks about the techniques that we use in our offices to help pull the stomach down away from the diaphragm so that the body can function on a normal level. So many of your healthcare problems are physical, not chemical. And you keep trying to treat them chemically, and then you get frustrated. Sometimes you need chemistry. Sometimes you need drugs. I am not against that. I'm against unnecessary use of the drugs and the surgery. And all the doctors I work with feel the same way. Whether they're chiropractors, surgeons, holistic practitioners, functional medicine doctors, I surround myself with people who think like I think and understand that, hey, if we can get somebody healthy without this, great. If we need it, it's always there. So folks, if you're sick and tired of being sick and tired, if you want to make an appointment to come see us, we have offices in Marietta, Duluth, and Stockbridge. We would love the opportunity to have you come see us. So go to my website, drjoeesposito.com, or just Google Dr. Joe, number one Dr. Joe in the world, and we will set you up a time to come see us. And we accept people with all insurances, no insurances, car accidents, sports injuries. If you look on your insurance plan, it says we're not listed as one of your doctors, and we are on a ton of plans. Call us anyway. Let us work with you. We have plans usually to work around with everybody. We want to get you well and keep you well. So if you're serious, we want to work with you. If you want to order Super Greens and Essential Source, that's on my website as well, or on Amazon. But we want to be your doctors. I know you're tired. I know you're exhausted. And pain, by the way, is exhausting. I know that. I fractured my spine twice, broke my arm twice. So I know pain. It's exhausting. So if you're ready to get well for you, your friends, and your family, drjoeesposito.com, or just Google Dr. Joe with the number one Dr. Joe in the world. Hey, folks, thanks for listening to the show. Thanks for telling your friends about the show. We'll catch you next time.
Thanks for listening to For the Health of It. Remember to subscribe to this podcast, and I'll help you naturally get well and stay well. You can also listen to and call into my radio show live Sunday evenings from 7 to 9 Eastern Time on WSBRadio.com and on a WSB Radio app.